Welcome to this video. Now I'm talking to Adam Rowland today. Adam, welcome. Thank you for coming.
No, thank you, John. I'm really grateful, massively important that we do this kind of thing. The reason why I'm grateful is it's not just myself, it's behalf on the whole of the vaccine injured community, because the reason why I'm saying it's so massive is, I've been injured for 3 years now. It's been pretty severe. I won't wish it on anyone, but we're censored by all the mainstream media outlets, and nobody wants to speak to us and trying to sweep us under the carpet. So for the likes of yourself and all the work that you do, I just want to thank you for that, and it does really mean a lot to us that you've got me on today to speak to me.
Well, the compliments of any go to you, Adam, for talking about your suffering, because it's not easy. And I've been reading your pathology results from this morning. Now, all of the things we're talking about on this video are attested by evidence from Adam's pathology results and results he's given us. And I will be sharing clips of that. Obviously, for reasons of confidentiality, I can't give too much information, but it is there. I've read it all this morning. I'm actually quite. I was quite taken aback, Adam, to tell you the truth, but from what I've read. I mean, I'm just going to go through some of it. So you've been diagnosed with what's called a venothromboembolism. So this is like a blood clot in one of your big veins that's gone to your lungs. You've been diagnosed with vaccine-based adverse events, and vaccine damage has been diagnosed. As I say, you've had these multiple pulmonary emboli, these blockages of the blood supply to whole areas of the lung. You've had a condition called ventricular tachycardia, where the heart is beating so quickly, I think in your case it was about 176 a minute, that there's no time for the blood to get back in. And that must make you feel so bad. You've got inappropriate ordinary tachycardia, like you get when you're exercising, but you get that when you're at rest. You've got something called post-vaccine complement in your muscles. Now, this has been confirmed. So someone stuck a needle in you. Was it in your leg, Adam?
Yeah, it was in my leg. So they cut an inch into my gastrocnemius, so my calf muscle in my leg.
Calf muscle.
Took a good few sort of strands of long muscle fibres, and then the histopathologist had a good look under the microscope, and they've also frozen a bunch of them for the biobank here in the UK.
Yeah. Abnormalities found in that, but one of them was what's called complement deposition in the muscles. Now, complement is the end path of an inflammatory pathway, and the complement will actually damage the cells in that area. It's good to have it for a short time, but you've had it for a longer time, which is bad. Maybe secondary to post-vaccine complement activation was the official diagnosis. Heart problems, you've been recommended for a possible ablation. That's a procedure on the heart. You've been tested positive for D-dimer. That is a test that indicates that there is blood clot in the circulatory system somewhere. You've been diagnosed with pericarditis, the inflammation around the heart. You've been diagnosed with this ventricular tachycardia. It's what's called non-sustained ventricular tachycardia. You've had tests that show you haven't got the traditional disease of your arteries. You have not got coronary arterial disease, which you would normally think about in these situations. And that's been confirmed with computerized tomography, coronary angiography, a scan looking at the blood supply through your coronary arteries. So you don't have the typical coronary artery disease that would be expected with these sorts of horrible cardiovascular compensations. You've been diagnosed with a degree of what we call atrioventricular heart block. So the electrical impulses from the top of your heart are not getting through properly to the bottom. And you've also been diagnosed with some right ventricular impairment and dilation. And the right ventricle is so important, of course, because that's the whole side of the heart that pumps blood to the lungs and receives blood back from the body. You've actually been diagnosed, I've stunned Adam, renal calculi, blockages in the ureters.
Yeah,
and then the whole
gone completely down the pan, John. So it was normal,
yeah.
And now it's like borderline stage 3.
The kidney function. Yeah. Yeah, and the blockages, which of course can be the most excruciating condition ever. Common A&E diagnosis. I've seen patients rolling around on the floor in the waiting room with this. It's terrible. And then you've been diagnosed with peripheral neuropathy. Now, peripheral means it's the peripheral nerves, all of the nervous system that's not the brain and the spinal cord, and there's disease of the peripheral nerves. And again, this has been formally diagnosed. It's been diagnosed by the biopsy, the histology. You've had electrical studies, the physiological studies, where people will give a little electrical shock in one part of the nerve and pick it up, and the electrophysiologists can tell what's going on from that. And you've also got some peripheral demyelination. Now, people normally think of demyelination as multiple sclerosis. But the difference is that the multiple sclerosis only affects the brain and the spinal cord, whereas yours is in the periphery. And you've also got facial skin rash. Now, critically, Adam, your spike protein is present in your antibody test. This is after you've been symptomatic for over a year. But your nucleocapsid protein was negative. Now, the nucleocapsid protein is part of the virus that is not generated by vaccine. So people that have had natural infection would have spike protein and nucleocapsid protein. People that have only had the vaccine would have the spike protein in the absence of the nucleocapsid protein, which is what you had. So I think that means we can say definitively, actually, that a year into your terrible symptoms, you had not had COVID infection, but you had had the vaccine spike protein injury because you didn't have the nucleocapsid. Now, we know you've had COVID since in the past year.
That was around about 2 years after the first vaccine, that blood test, John. So that's quite alarming.
Wow.
Isn't it?
Right, now, I just want to emphasise a point here, Adam, please. 2 years after the vaccine. Now, the normal range for spike antibody is 0 to 0.79. So well under 1. Yours was 220. But it's more than that. Tell us why it was probably more than that, Adam, please.
Yeah, so I got the test results back, and obviously looked at them and asked what they meant, and I just got told that the ceiling of the test is 220, and the comment when the test was sent back was actually it was a lot higher, but they couldn't quantify how much higher because of the ceiling of the ability on the test.
So your spike protein antibody was at least 300 times higher, than what you would expect after a vaccine, and potentially thousands of times. So we can say several hundred to many hundred of times higher than it should be, and this is 2 years after. So that indicates to me that you are still producing this spike protein after 2 years, and that is just a sketch from the notes that you've sent me, Adam. I mean, I'm just so sorry that you've had this huge amount of suffering. It's just, and it just shows why we're so grateful to Adam for coming on and sharing this suffering with us. It can't be easy.
I'm sharing it, John, because the thing is, they want us to keep quiet, John. The pharmaceutical industry, the government, they want us to keep quiet, and I'm not going to lie to you. I wouldn't wish this on another living thing, and it is so tough. I can't even put into words how tough it is, and I wouldn't still be here, John, if it wasn't for the support of lots of people behind the scenes. That they basically, John, I fall and they pick me up on a daily basis, and there's no way, like, mainstream media might not talk to us, and we can compare it to other scandals like the post office thing more recently, and it might take years, but I can't just lie down and not say anything, because like I say, it's not just me, John. It's a little bit easier for me because the facts are there, which is a bit of a problem for other people, but there's so many of us injured like this. I've just got to try and the way that I look at it, turn it into a positive and try and make a difference. Even if it's a tiny difference, right? It's better than nothing.
What we will find in the comments, Adam, is that there'll be many, many people commenting saying, I got that. Most people hopefully won't have as many wide injuries as you, because you've got respiratory symptoms, you've got nervous systems symptoms, you've got cardiovascular symptoms, and you've got skeletal muscle symptoms. I mean, it's affected you in 4 appalling ways, but this will be resonating with other people. Prior to this, Adam, were you a bit unfit, or what sort of shape were you in?
No, just on that as well, I will point out, John, I've got lots of other problems I didn't list. So with my vision, I've got under someone for my vision, tinnitus, but I didn't mention those because those kind of things like become nothing in your life now, So I've got loads of other symptoms which other people have. I just didn't, I haven't gone to the hospital with them. Otherwise, I'd be there permanently. So yeah, just to get back to your question, prior to this, yeah, I'd like to consider myself pretty fit. I mean, personally, I was the fittest I'd ever been in my lifetime. My background was I worked in professional sport for the last 17 years. So I was lucky enough to work in numerous rugby league teams, St Helens, Castleford, trying to think who else, Widnes, etc. England, I did a bit of work with England there for the national team. I worked on an overseas base for the military, an operational base overseas as a locum for a year. I did some extended scope practitioner work as a physio, and then I was one of my last jobs, I was working on the PGA Golf Tour in the USA. So it was my dream job, John. It took me 17 years to get there, and finally, it wasn't about money for me, my job. It was about enjoying it and doing what I wanted to do. But it was nice to finally, get rewarded for all that work. But yeah,
you're at the absolute top of your profession, Adam, basically, weren't you?
Yeah, I was doing all right. Yeah, like you're saying, I was fit.
Yeah, you were. Again, Adam's sent me some documentation of this, about the PGA Tour and things like that, and it's all there. I have seen all this. It's an impressive CV. And what about, were you bouncing up and down fells? Were you running?
Yeah, so like obviously because I used to look after the athletes, so the injured returning athletes, so the rugby players. So I'll give you an example of that, for me to survive and keep my job for so many years, we use things like GPS, so we know the demands of the game and demands of a training week and the demands of a season. So the worst thing that I can do is return an athlete back into training or back into competition, and he either breaks down with that injury or he breaks down with another soft tissue injury, which basically says that he wasn't fit to return because he didn't do enough conditioning, etc., for the demands of the game. So to cut a long story short, whatever conditioning programs I would give them before I handed them over to the strength and conditioners to when they were more mobile, etc., I would do those programs myself, so I could ride 10 kilometers on a watt bike, in sub 20 minutes and things like that. I could row 5k on a rowing machine in 18 minutes or whatever. So yeah, I was pretty fit. Yeah.
And then when did you have your first COVID vaccine dose, Adam? Is it February?
February 21.
February 21, yeah. And you had the AstraZeneca vaccine?
Yeah.
That day, were you okay?
I was okay that day, and then into the evening I developed a pretty bad fever which kept me in bed for at least 3 or 4 days. I remember it being, I think, on a Thursday, and it sort of kept me in bed right over the weekend.
And then what did you become aware of after that?
Yeah, it was really weird. I'd be going to sleep at night, and then just for no reason in the middle of the night I would wake up like my heart was stopping and I felt like I was dying, and it was just this immediate terror. It felt like I've never been thrown out of a plane without a parachute, but that's how it felt. It felt like I was falling to my death, and it was the most unpleasant feeling, having never experienced it before. And then my wife started to notice that this was happening, but I would be flailing my arms and legs about, but I wasn't aware of it, and I'd developed all these pains down my arm and my leg, like these nerve pains, and then it just developed from there. Really, it just got worse and worse. Those symptoms where I couldn't lie down in the bed, because as soon as I started to lie down, it was even before getting to sleep, my heart would just start doing all this stuff. I'd get incredibly dizzy, like this falling off a cliff and vertigo feeling, and it quickly turned.
You said you felt like you were dying.
Oh, I would. It was, up to then the worst experience of my life. Yeah, something wasn't not right.
I think what might have been happening, Adam, was that you were having these abnormal heart rhythms. Your heart was unable to generate any blood pressure. There wasn't any blood pressure going to your brain, no blood going to your brain, and that produces extreme anxiety.
Yeah.
Terrifying anxiety. Absolutely horrible. And at the time, you were getting cardiac palpitations, which you now know are these abnormal heartbeats that have since been diagnosed.
I'd never had anything like that in my life, so I didn't know what I was experiencing. I really didn't.
Yeah. And the nerve pains and the heart symptoms came on at the same time.
Yes, yeah. The heart thing probably precluded it by a few days, but yeah.
Yeah. Now, what was the pain at this time? Was the pain restricted to your arms at this time?
Yes, it was. Yeah, just my arm and my leg more on my left-hand side. But then it turned into, I remember once it had been going on a few weeks, it was like restless legs in my legs. It was like this nerve pain, yeah.
And is it quite bad? Was it like shooting pain? It's what you call a neurologically referred pain, or what was it like?
Yeah, so it go down the whole of the arm, and it's really difficult to explain, but it sort of felt like someone wiring you to the mains and sort of electrocuting your nerves. And what happened was to interrupt the pain, I'd have to keep like moving my arms just to, give myself another sort of proprioceptive stimulus, just to take my mind off it, because I wanted to like rip my arms off. It was horrendous.
And then when did the chest pain develop, Adam?
Yeah, so the chest pain developed in May immediately after the second vaccine. Yeah. And that was pretty horrendous, and that's the start of. It was bad before, but I dealt with it before and was plodding on, and I'd had some. I think I'd had 6 weeks off work after the first vaccine, which I'd never had anything like time off work with sickness before, so it's quite embarrassing, because I didn't know what was wrong with me, and I had to tell my employer that. The doctors are saying I've got anxiety and they want to try me on these antidepressants. So, I had to come clean with them, because I didn't know what the hell was going on with me. And I told them, and they were hugely supportive. But then I got the second vaccine, and it was just, it was horrible. Yeah.
It's so obvious after the event, isn't it?
Yeah, I didn't suspect after the first one, John. I didn't link it.
No, it's just so. There's a saying in medicine that the retrospectoscope casts a clear white light. It's just so obvious after, but not at all at the time. And the GP initially diagnosed you with nocturnal panic attacks.
Yeah, which I couldn't get a face-to-face appointment with the GP, so it was just done over the telephone. And then I remember, my GPs must have hated me, because I was on the phone maybe once or twice a week at one stage. And I'm like, you've got to help me. And they was like, there's nothing wrong with you, and convinced them to get me an ECG, which I had. But of course, my evidence with the thing with my heart is it doesn't do it. I'm luckily that it doesn't do it that often when I'm sat up and when I'm, it's sat around. So it didn't capture it, because an ECG, right, what was it, 15, 20 seconds of one capture. So if it's not doing that rhythm. So, of course, the GP got that back. There's nothing wrong with you,
Well, that's because you had a very healthy heart before this.
Well, yeah, my resting heart rate was like, 38. Sometimes...
You're an athlete. You're a young midlife athlete.
Yeah.
Yeah. And you were prescribed diazepam and antidepressants.
Yeah, and I just they just made me even worse. It was horrendous because I wasn't sleeping, John, because of the symptoms. The antidepressants made it even worse. So I had to come off them, and then it was horrendous.
Such a classic medical mistake, isn't it? Missing a completely biological, organic diagnosis and just saying, "Oh, it's just in your head. Off you go."
Yeah,
infuriates me. Intolerable. So you had the you didn't realise what was going on. You had the second vaccine, and then you developed pretty well constant chest pain. Adam, tell us about the chest pain, please.
Yeah, so I developed constant chest pain, but it wasn't like, so working in rugby, I'm not a tough guy, right? But when you work with a population of guys that are tough, you tend to like want to be a bit tougher like them. So when I developed the chest pain, I just thought, I told myself, I knew it wasn't quite right, but I told myself it's costochondritis, and I went, you've just been,
which is just the inflammation of the chest wall.
Yeah, so I just thought, it's just a bit of that. I've been pushing myself too hard at the gym, because at that point, even though I was very sick, I was one of these that I've exercised all my life, 6-7 days a week. So I continued to do some light exercise. So I thought, it's probably, I just told myself,
just your way of life. It's just what you do.
I'm not going to give up, because I've done that since being a kid. So anyway, I just told myself, it's, you've done too much at the gym, which I knew I hadn't. And then it was constant, so I thought, what should I do here? Like, it didn't feel bad enough to go to A&E, because it was just like, it was 5 or 6 pain, and it was like, it's manageable, it'll be gone in a week or something.
5 or 6 out of 10 being the worst, yeah.
Yeah, so I phoned up 111, and they just, they told me to go to A&E, and I thought, nah, I'm not. I knew I wasn't having a heart attack, so I thought, I'm all right here, it'll go and stuff. And then it just developed from there. It wasn't all right. I started to get severe dizziness. It happened a few times while I was driving. It would literally be, it felt like I was going to, like, I thought I was dead. So it was like someone had turned the light switch. I'd be driving along, I'd go boom, horrendous pain in my heart. I'd literally for a couple of seconds not know what was going on, and then I'd horrendous dizziness. Last, another 5-6 seconds, I'd be surprised that I hadn't passed out. And then I was like, shit, what is going on? And then the pain just got worse and worse, and it accumulated where I passed out a couple of times. And then one particular evening, it was a Sunday evening, I was working on the computer for work the next day because I'd had a graded return back into work. And I went to stand up, and I just got the horrendous classical heart attack. It was like a vice, crushing pains in my chest. Sweat was pouring off me. I could hardly speak. I was so breathless. I couldn't move and walk about. And my brother at the time had to phone an ambulance because my heart rate, I don't know if it was reliable, but I was on, I got one of these watches, and it was, alarm was going off because it was, 180s and stuff like that for no reason. But I really thought I was going to die, and an ambulance came out, did an ECG, said there's a few little small abnormalities on your ECG, but doesn't seem like you're having a heart attack, but go to hospital. And then they just did the usual. They looked at me and said, did your troponin checked, a couple of troponins, ECG, and went, well, you're not having a heart attack, we think it's anxiety. And I was just like, nah, this is not anxiety. And they were like, well, you've got, 3 causes of chest pain, which, it's either, respiratory, cardiac, or psychosomatic. He said, and it's not respiratory, it's not cardiac, so it's psychosomatic. So I was like, really, really peeved. Said, you better go back. I mean,
it seems obvious to me what's going on here, Adam. Your heart rate was so fast that your heart was not filling with blood properly.
Yeah.
If your heart's not filling with blood properly, the blood's not being pumped out properly. And the first 2 vessels, as you'll know, that leave the aorta are the vessels that go to the coronary arteries. So you had a very fast heart rate. Your heart was metabolizing at 90 to the dozen. The blood supply to the heart muscle had gone down. Therefore, you developed severe acute angina, myocardial ischemia. And the fact that A&E doctors didn't know that is a bit concerning, to be quite honest. But there's other lessons I think we have from this. So initially you got some symptoms and doctors said it was anxiety. And also you did what human beings do. You went into a bit of denial. You don't want to have cardiac pain, so you say, oh, it's just this, oh, it's just that. You know, I think I would appeal to people, don't say, oh, it's just this, oh, it's just that. Go and get checked out, get some investigations and get it properly diagnosed.
Well, what I did do, John...
This sounds like a horrendous pain.
After that incident, because it carried on, I got 2 more episodes, not as bad in the pain-wise, but where the dizziness, and it was clearly not right. I contacted a colleague, a club cardiologist that worked at one of the rugby teams, and I just told him, and he said, well, you know, if they've said it's anxiety, it likely is, but he said, from what you're describing, we'll do a 24-hour ECG, which is what picked up the VT, yeah.
Yeah, the fast heart rate, and we can look at a picture of that actually now. I can put that in on the edit. Then you were going forward to June, Adam. You were referred for an MRI, a magnetic resonance imaging scan. What was the thinking behind that? Yeah,
so I had another collapse episode where I was taken by ambulance, and this time because they saw the VT on an ECG, they took me straight up to acute coronary care unit, and they monitored me there for a week. They wouldn't let me get out of bed. And then that was when I had the high D dimer. And then, you know,
indicating the blood clots.
Yeah, so I just told them, you know, I was like, look, I only had this vaccine a couple of weeks ago. I said, this is all since this vaccine. So, you know, they didn't deny it, but then as soon as they saw the D dimer and the VT, that's when they sort of took it serious. But they were telling me, like, you know, it's Brugada syndrome. They still weren't having it was the vaccine. One guy still couldn't believe it, was saying, oh, you've got a lot of anxiety about this. Tried to put me on mental health medications. I've even got in my notes,
well,
John,
imagine getting anxiety because you think you're dying and you've had the most excruciating pains of your life. Imagine that.
Well, I actually got in my medical notes, John, that I've got like a 2-sided piece of paper where they were having an argument about prescribing me an antipsychotic for anxiety. One cardiologist said it's too dangerous for him, and the cardiologist was like, no. And this guy was trying to telling me to take it, and I was like, I'm not going to take that. I said, why would I want to take... So anyway, they referred me to a specialist heart hospital, Liverpool, because the local hospital didn't know what to do with me.
Yeah.
They were saying that they were talking about an ablation and also an ICD at that time, and I was like, what? You know, I was shocked.
So the ablation is actually killing part of the heart muscle where the abnormal rhythm is coming from.
Yeah, and then got the MRI, which I actually paid privately for because I got put there and I wanted to go back to work again, and I was scared of losing my job because I'd had a lot of time off already. So I actually paid privately to speed the MRI up because they told me it'd be like, you know, they didn't know how long because COVID, it could be 3, could be 6 weeks waiting. So I thought, you know, an MRI, £1,000, I'd rather pay for it at that time, and I'll be back on my bike and sorted. And I got the MRI, and it didn't actually show anything. And the consultant was a bit bamboozled. He just said to me that normally when you see these patterns, that somebody's got something structurally wrong with their hearts, and they didn't find that. So he was like, well, you know, I can't really help you. And then that's when the merry-go-round of the NHS and the NHS system swallowed me up from there, really.
Mm-hmm. So what happened next after that, Adam?
Well, he suggested there could be an adrenal component, so sometimes like tumours of the adrenal glands and things like that could potentially be a rare cause of this. So he sent me to an endocrinologist, which you know, I waited a few months for. You know, by that time I was unable to work anymore, you know. So he sent me to an
Before this time, you'd had butterfly rash on the face. You'd had an episode of jaundice, bladder issues, cramps in the legs getting painful, turning into restless legs. Couldn't sleep for up to 5 days. The sleep deprivation must have been torture in its own right. You're actually hallucinating because you couldn't sleep, because if you have enough sleep deprivation, you start dreaming when you're awake.
I remember at the time I was, up all night and I could not lie down because the symptoms were so bad. And, if somebody had seen me, they would have sectioned me, John, and it would have fit their mental health diagnosis, because I used to have to walk around the backyard in circles all night because of the pain in my legs. And then
you got pain in legs getting too severe no matter how tired I was. So really extreme pain in both legs.
And, my mother, by this time I was living with my mother because, things had happened. And my mum would come downstairs and I'd just be crying and I'd be like banging my head against the wall, just screaming for it to stop. It was just like, if you'd seen me, like, you would have just thought, this man's crazy.
So were you in this pain like 24 hours a day, Adam?
Yeah, pretty much, but it would come in waves, so it'd never get better than like a 5 or a 6, and 5 or a 6 to me, John, is like, you're a bit gnarly and you're very, very grumpy and you can't really have conversations with people, but you can move about and get on. But once you start getting above, like, when you're getting into your 7s and above, then you can't lie down, you can't sit down,
you can't do anything.
No, you can't do anything.
No. Appalling. So you'd had pain in your arms, pain in your chest, pain from your kidneys, and then this intolerable pain in the legs. And you are describing intolerable pain. What was the pain like, Adam? What would people relate to? Was it like sharp? Was it electrical? Was it crampy?
Yeah, so when it first started in the June, it just started as bilateral cramps and it felt like delayed onset muscle soreness that, from unaccustomed exercise. Yeah. And again, like I did with my chest, I just thought, oh, that's weird. I've not been exercising. It'll be gone in a few days. And then the cramps just developed. And then by this time into the autumn, the constant symptoms of feeling like your nerves were plugged into the mains and having this electrical, it's really hard to describe. It just feels like electricity going through your nerves all the time.
It's like you're in a torture chamber somewhere being electrocuted.
Yeah, that was it. But then that turned even worse. So it turned into it was so severe. It felt like someone had a knife underneath my bones, deep into my muscles, and was just basically going like this down my legs all the time. And when I said I couldn't sleep, they tried me on sleeping tablets and all kinds, and then I'd take all these drugs. They'd briefly knock me out for about 2 hours. I would wake up and I could not still lie in bed. I'd wake up and try and resist because I was exhausted. So I remember stretching my legs up against the wall like 90 degrees, trying to stretch them out. It wouldn't do anything. And then the only thing I could do was just get up and walk around, and it would occupy my brain. It would divert my brain from the legs.
I mean, you're describing severe peripheral nerve pain, I think, aren't you?
Yeah, and I ended up. It got so bad. I ended up going to A&E multiple times with it in the end because I people may not. It was horrendous, John. I have a gate in my backyard and it runs onto a main road, and the thought did cross my mind about just running into the main road, and I just wanted it to end. And then I thought about my children, and I just thought about the person that was driving the car as well. But I feel stupid, but I would just look up to the sky and I'd be screaming and begging, just saying, please stop,
And then you saw the endocrinologist, and eventually you had an MRI brain scan. Multiple bizarre linear areas of hyper intensity. So there was a brain lesion then, Adam, as well.
Yeah, so I have got some brain lesions, but I don't really want to know about them. So that I think they've talked about doing another brain scan. So I do know that my brain was clear prior to all this because I had some head injuries in my time from sports and stuff.
Yes.
So I actually had a brain scan in 2019 and it was all clear.
Yeah.
And then that one showed it, and they said it was bizarre areas, but then they just put it down to, they said, oh, well, it must be artifacts because they'd never seen it before.
Yeah, they say hyper intensity, which just means, I guess, a denser area. I think that's all that means.
Yeah, And then I've since had another one, and it's just showing the white spots on the brain, which again is a common finding when I speak to the vaccine injured community. So it's just an area of, if you like, degenerative dead brain. Yeah.
Yeah, I mean, it's just affecting so many parts of the body, isn't it? November 2021, feeling so ill and looking so ill, I felt like I was dying. GP commented how ill you looked, told you to go to A&E. More heart problems, dizziness, A&E again. Was there anything that helped? Did any drugs help the pain, Adam? Did morphine help? Did paracetamol help?
No.
Did anything? Nothing?
Nothing helped. And I remember on this occasion, I've been telling you about the dizziness and all the spinning that I get, which later got found out to be unstable blood pressure. But anyway, I was telling them in A&E about it, so they injected me with these, like seasickness anti-drugs and things like that.
No, antiemetic things.
Yeah, and that made me even worse. It was horrendous. It was weird, and they were just thinking.
The problem was you weren't getting enough blood supply to the brain. Not the yeah.
No,
it's
no.
just
but they thought
another misdiagnosis. I'm afraid.
Crazy man going in there, and they were giving me this, and I was getting worse. They were thinking like, "What's going on with this guy?" Because they actually...
I must say, I'm very disappointed by the level of medical assessment you had.
John, they gaslighted me. They took me in a room and told me that it was a lovely, go and enjoy your life out there. It's all anxiety. And they referred me to the local mental health team and said that it was all mental health.
Pain is what the person says it is, what the patient says it is, existing when they say it does. This isn't an axiom of healthcare.
I asked for the.
If someone tells me they've got pain, they've got pain.
I asked for the clinical director, John, and I won't name the hospital. I asked for the clinical director, and I said, "No, I'm not satisfied with this." The clinical director came in, and the people that had been telling me it was all, they're referring me to mental health. They told me that I was aggressive, and it was all mental health, and to go and enjoy, stop getting so worked up and go and enjoy myself. There's nothing wrong with me.
So several doctors failed to diagnose you, but we know your diagnosis was correct because we've got the pathologist report, we've got the histology, we've got the x-ray results, we've got the blood results. We know that you were genuinely suffering these things. Going on into the next year, so we're into 2022 now, Adam. So January, weakness and starting to get loss of muscle mass at this stage.
Yeah, and then...
But again, still constant pain in your legs.
That was when it was at its worst for about 3 months, and then I had to go to A&E numerous times, and I saw ex-colleagues, ex-doctors that I used to work with in A&E, and they looked at me and they were like, "What the hell has happened to you?" And I told them, ever since this vaccine...
So the penny was starting to drop, was it, after a year?
Yeah.
The best part of a year.
But then they just said, we'll do more tests as a bit of a favour to you than what we normally run in A&E. And then they just sent me to a neurologist because they said, "You've got peripheral neuropathy." And of
course that was formally diagnosed via the biopsy, via the peripheral nerve conduction studies. So there's no question that is there. And that caused... There was a motor neuropathy, Adam, because you lost muscle mass. And the sensory neuropathy... It's probably what was accounting for this intolerable level of pain. And that this pain just went on for month after month. It's no surprise you became just totally distracted with it. It's just incredible.
I didn't have I still don't really, by normal person's standards, have much of a life, but at that point it was literally... just trying to survive like most of us do each day. But it was survival, I'd describe it as.
By summer 2022, you had another collapse at home. Basically, you had almost a cardiac arrest, really. You went into this ventricular tachycardia rhythm. So dogs are always welcome.
Oh, he's been asleep.
We're a dog-friendly channel. And again, the severe chest pain at that stage, Adam.
Again, yeah. So I remember it hadn't been as bad as the previous year. It felt, again, stabbing, crushing. and then my heart, I could just feel the dizziness, and I could feel it, and my watch was telling me that it was going at 180 or whatever. And I remember thinking, right, I thought I was going to die in my bed, and I was upstairs in a bedroom at this point, and I thought, I've got to go downstairs, because it was the middle of what I thought was the middle of the night. And I thought, if I don't get to that phone and make this phone call for an ambulance, and anyone who's had a lot of ambulances like me, there was no one to answer the front door. So I was like, how are these people going to get in? So my survival instinct was, I crawled on my hands and knees down the stairs. I don't know how I did it. I got to the phone, dialed 999, and I don't remember anything other than when they came in.
And, you know, we're not going to go into this, but obviously at this stage you were, sadly, living on your own at this stage.
Well, I was actually at my mother's, but my mother is, you know, she's got Parkinson's and elderly, so...
You had to do it, yeah.
Yeah, I didn't want to wake her up, and that was the last thing on my mind. I woke her up.
And of course, the worst thing you want to do is bother your parents as well, isn't it? I mean, that's...
Well, she'd already seen...
Anyway, you're in hospital... Yeah, I mean, she obviously knew what was going on.
Yes, yeah.
So it's torture for your mother as well as for you, obviously. So June 2022, you're discharged home despite still severe episodes of chest pain and inability to lie down to sleep. So still going on into June, into July, you got second opinions.
Well, before July, John, I'll just for the listeners, because other people experience these emotions. I had a further 6 ambulances out to my house because the chest pain was so severe in the instances. I couldn't lie down, so I was sleeping or living in the front room by this point, because I couldn't go past 45 degrees. So I had the couch and prop myself up. I'd watch box sets till 5 in the morning, and then when I was exhausted, try and with all the painkillers, try and do a couple of hours. But I had to have so many things, and I just get told, you've got pericarditis, your GP can manage this, stop wasting our time, and sent home. And then I got a knock at the door. And it was 2 people from the local council or something, 2 nurses, and they said, we're part of this team because you phoned 15 ambulances or something around that figure in the last year. So when someone phones so many ambulances, you do realise it costs over £1,000 a time to call an ambulance. So, you know, we need to investigate what's going on. So I obviously had some of my discharge paperwork. They could see me. I told them my story and gave it to them, and they were pretty disgusted and heartbroken themselves. They turned around to me and said to me, it wasn't the first that they were hearing of people after the vaccine having trouble. And then said to me, look, you know, from seeing you, you look awfully sick and not well. If you keep having the pains, keep phoning the ambulance. Well, I would have been there every single night, John, so I wasn't, but it was only when it was, you know, hanging on, white knuckling it, that I was. And they even went to my GP, John. They drove to my GP in support of me and said, this man's desperately sick and he needs your support. And I was really touched by them, John, because one of them actually gave me his telephone number and said, you know what, when you get through this, we'll go out for a coffee. I'll take you for a coffee together. And I was like, the support of someone who was in the medical profession, who said to me, you know, you're doing the right thing. You know, it's not, you know, we've seen all the documents, and it meant so much to me. And it was them that said to me, no, go and get a second opinion. And that's, you know. So 2
nurses came round and hallelujah, they believed you.
Yes, they believed me for the first time. Someone was like,
and no. The relief of that is immense, isn't it? People believe you. 2 professionals actually believed what you were saying. Now, you did make contact in June with your MP, Adam.
I did. So this is when, you know, I'm lucky in some respects, John, because of my medical background. So when they were gaslighting me, telling me it was in my head, they were still fobbing me off, getting rid of me. But I was challenging them, saying, by this point, this is BS, you know, this is rubbish. It can't be. But some people aren't fortunate enough. You know, I've got enough of a knowledge that if they say, oh, you can't have a scan for such a reason, I can rational and come back at them, and they know that they can't BS me, because I've worked alongside doctors, etc.
Yep.
So, but by this point, I was still getting told that, you know, you're going to have to wait 6 months to see a cardiologist again and all this. We were 60% busier than we've ever been, I got told, so we can't see you. Why are you priority with some of the comments?
Well, the level of pain you were suffering might be one of the reasons, but yeah, never mind.
So so I started to send all my discharge and medical letters to my MP, and I've had a relationship from my MP that has been supporting me as best she can since that point, which I'm really grateful for.
Yeah. And you had various second opinions and the diagnosis was confirmed. August to September 2022. Spent over 4 weeks in hospital. What happened during that time, Adam?
Yeah, so when I went for the second opinion, I was convinced I was dying, John. I'll be honest, I didn't think I'd last more than the summer. So my first comment to the consultant was, I said, am I going to die because do I need to tell my children? Yeah. So he said to me, I've got your scans from the other hospital. He said, I don't think you're going to die from your lungs. But he said, I'm really concerned about your heart. He said, you need an urgent cardiac opinion. And he said, I'd suggest one of my colleagues. So I got that opinion. I had to pay again. So I had to pay money privately again.
This is just outrageous.
Both of these guys immediately said it was the vaccine. They even told me I was about the 239th person at that hospital with similar problems that they'd seen, which I was shocked at, to be honest, because I thought
there were hundreds of people with similar conditions.
I thought I was the only one up until this point, and then I found social
just media. Like the postmasters, Adam. I'm the only one until they started talking to each other, and that's why we're doing this, because there's hundreds of people suffering like you out there, thousands around the world. Tens of thousands, who knows? And
he just took it serious like you, John. He looked at the ECGs and he went, your heart doesn't go into VT for no reason. Nope. He said, we need to look at you again. And he said fairly urgently. So he wanted to know if he had private medical insurance. He said, I'll get you in tomorrow. And I was like, I can't afford it all. He said the scans were going to cost, a few thousand. So he got my records and he got me down there within about 2 weeks, I think, on the NHS, and I spent a month in London as an inpatient.
Wow. And you had cardiac testing, you had sleep studies. They found your diaphragm wasn't functioning well as well, Adam.
Yeah, that's ongoing. I'm supposed to keep going back to London for that. I'm actually going in February. I've been too sick to attend my appointments for that since, but apparently it's a common thing with long COVID and vaccine injured that I know people that the diaphragm actually, it's horrendous. I've witnessed it where the diaphragm physically stops moving. It goes into spasm and they can't breathe, they're choking, and somebody has to physically punch them to release the diaphragm. So there seems to be some
almost like one of these choking maneuver things.
So I don't know whether there's a phrenic
abdominal thrust maneuver.
Yeah, I don't know whether there's a phrenic nerve thing going on there, but apparently it's quite common in long COVID and stuff as well. I've been told from
pathologically, we know that this is affecting your muscles. We know that this is affecting the peripheral nerves, and now it looks like it's affecting the two phrenic nerves, which, as you know, comes from fairly high up in the neck and goes down through the chest to the diaphragm. And of course the diaphragm is the most important breathing muscle, of course. Most chest volume changes from the
so I desaturate usually overnight. Not it drops into the mid-80s, sometimes a bit lower.
Your oxygen
so they were on about
normally your oxygen saturations wouldn't drop below about 97 probably.
Right. Yeah well, they've never been normal since obviously what happened with the lungs and stuff.
I mean, your normal would be 96, 97, 98, 99, 100, those kind of levels.
Yeah. So they run about
down
CPAP,
the
but then I didn't get CPAP. But then at times I've had to buy my own oxygen machine because I actually did some plane travel last year and it was dropping well into the low 80s, so I needed oxygen. Yeah.
So that would be a tight fitting mask to help you breathing overnight, like we use for sleep apnea. Yeah. Very weak. Now you had a spinal MRI that showed isolated cervical vertebrae bone marrow abnormalities. So something not quite right with the spinal cord as well, and these white spots on the brain. Multidisciplinary team diagnosed suspected myopathy, adverse muscle biopsy, and and you also got opinions from neurologists. So it's affecting your nerves and your muscles. I think that's pretty clear. So how were you when you sort of left hospital in September 2022, Adam? Were you any better?
A little bit. So by that point, so what they did with me, they were fantastic there. I got assigned like I don't know whether you call them a care assistant or support worker or whatever. Anyway, I got assigned somebody because they were concerned about my mobility, lying in bed with so much pain. So they were trying to get me to ambulate, and of course some days I could ambulate down the corridor in the ward. Other days I could ambulate out of the hospital across the road into the park, and then other days I literally couldn't do anything. So they basically said, obviously we need your bed now. You've been in hospital. This is a specialist heart hospital. Where elective surgeries. People are coming in for bypasses and everything. And leaving after a week. So they basically said, we need to get you back up north now. They put in place a care package for me, mental health to support me mentally, which I didn't take them up on in the end, and also like carers to come and care for me at home. They actually advised me at that point, which I thought was disgusting because, they said to me, with what's wrong with you, we advise you not to try and do any exercise, so don't try and push it when you're walking. You could actually speed up your problem, was what they said to me. So I didn't take that.
What is life for if you can't be active?
Yeah, well, I'm a physiotherapist, so I understand if you do too much, I'm going to cause damage. But there's a fine balance, isn't there? Everything in moderation. So they discharged me, and they wrote to my local hospital and said you need another lung follow up in 6 weeks. You need to see a haematologist, so they wrote to my GP referring to a haematologist. That was the advice of the team. I also need to be seen by another cardiologist for monitoring in, and need to see a neurologist to get the biopsies done. Now you wouldn't believe this. I never got to. I never got the respiratory appointment. Didn't get one for 18 months. Never got it. They were too busy for me at my local hospital, so I never got that. Neurology took, so I left there in the September, did not get the biopsies till June the next year, and they were telling me it should have been done in 6 weeks, and they could have had it done in London in 6 weeks, but because they have the access to do that in their hospitals in 6 weeks.
And when the biopsies were done, they were positive. You did have the disease there.
Yeah.
It confirmed it.
Yeah, and then, haematologists, I waited until the January. I saw a haematologist who completely gaslit me again. She said to me, well, how do we know all this is from the vaccine? And I said, look, I don't care whether it's from the vaccine or not now. I've come here for you to help me. So she said, well, what you've got wrong with you, it's easy, just stay on blood thinners for life. So I was like, I came away feeling like she'd abused me. So I spoke to my MP. I spoke to a lady who, behind the scenes, has been a bit of a hero for me as well. So there's been one doctor from a long COVID clinic who's done everything she could to support me. And I spoke to her and my MP, and we decided between us that I should complain to the hospital about what she said to me and how she treated me. So we did. And then they put me in with another haematologist who I saw just in September, who was fantastic with me. He turned around and said to me, look, if you'd had plasma exchange, plasmapheresis and IVIG in the beginning, in my opinion, you wouldn't be in this mess. And he referred me. He said, I haven't got the ability, because of what I suspect is happening, what COVID is doing to bloods. He says, I haven't got the ability to perform these tests here. So he sent me to a Queen Elizabeth Hospital in Birmingham, and they've got a research unit there. So doctors who work on the clinically for half a week, research for half a week. I've had some research blood tests done there in December. I'm actually going to get the results this week through. So they were very helpful to me after the complaint. But the thing that I want to explain, John, is, I was bedridden, in and out of bed. I quite often have to get patient transport to appointments because I can't physically ambulate and drive and things. So when someone gaslights you at an appointment that you've been waiting for months and months and months and refuses to help you and sends you out the door, making you feel even worse after you've been through all this trauma as long as I have, you haven't got the mental or sometimes physical capacity to complain because you know how drawn out it is.
You've got to work out what form to do, what computer site to get to, who to send it to, how to fill it out. It's just a load of hassle that you don't need.
It is.
Jobs.
When you're in so much, you're feeling so let down, and you've told your story. So again, I was lucky I got help with that complaint. So again, I mean, this is just anecdotal, but I phoned up the hospital, PALS department, and said, look, I'd like to make this complaint. And the woman on the phone was absolutely fantastic. I've been so lucky. She said, my father-in-law died from that vaccine. She said, I know other people that have been injured from that vaccine who I think have been injured from it, should I say. And she actually did all the paperwork for me. She said, tell me what happened, tell me what you think, I'll write the letter for you and you can sign it. And that's
wow.
what we did.
It's the way it should be.
So helpful. Some people along the way, John, have, it's really has been polar opposites in my case. I've had the...
Just brings out the best and the worst of humanity, doesn't it, Adam?
Yeah. So.
January, back at home, 2023, you passed out again and you were diagnosed with an atrial condition that time as well. So you'd already had the ventricular condition, the lower part of the heart, then you had atrial fibrillation as well.
I caught COVID for the first time, John, and that's, I think, what's caused that.
Right, now this is important. January 2023, you got COVID. Before this, we know you did not have COVID because you didn't have the nucleocapsid antibodies. You did have colossal amounts of spike protein from the vaccine.
I was also tested every day with my job with lateral flow, and also round about every 2 weeks we were PCR'd. So I was working for a professional sports team. So if anybody, more than 2 people got COVID, we didn't play any games or anything.
So we can say definitively, I think definitively, up to the 23rd of January, all of these symptoms were vaccine induced, not COVID induced.
100%.
Yep. Now, going through to, so you saw the haematologist in February 23. April 2023, you saw a vascular surgeon. What happened there, Adam?
He was
looking at the blood vessels.
Yeah, it was fantastic again. So because of the state of my legs, because I've got extensive like fungal toenail disease on there since all this happened, my toenails are, it's probably the fungus, but at times they've been like dark brown and sort of almost black, not quite black. I shed all the skin on my feet, and there's just indications of my circulation being slightly compromised, and when the consultant was feeling my dorsal pedialis pulses and things like that.
Yeah, that's the pulse in your lower part of your leg.
Yeah, so they were struggling to get good pulses and things, so they and because of all the brain issues with the dizziness and the vertigo and the brain scan, they were just a bit concerned. So I got diagnosed. When I say diagnosis, I've got a letter where they suspected that I had severe thrombolytic vasculitis and widespread vascular neuropathy. So they were suspecting it was a vascular cause of all my muscle and nerve problems by reduced blood flow in the small blood.
It does make sense. So the vascular surgeon did say that your big vessels were okay, like your femoral artery and your big vessels, but you said your small blood vessels were diseased, like someone who'd smoked 60 cigarettes a day all their life.
Yeah, now that's an inferred diagnosis, John. So I mean, you might be able to tell me more. So I think they inferred that from my VQ scan of my lungs, because that shows. Yeah,
well, the VQ scan is the VQ scan. So VQ, ventilation, Q is the blood supply. So the VQ scan looks at the ventilation, breathing in and out. The Q is the blood supply. It's the physiological letter that indicates the blood supply. And you had mismatches.
Yes.
In other words, you had areas where the ventilation was getting to, your lungs were still inflating, but there was no blood to those areas. That diagnosed the pulmonary emboli. Now, the vascular surgeon was looking at the perfusion of the blood to your legs. So the large vessels were okay. It was but of course the larger vessels feed into smaller vessels, which feed into arterioles, which go into capillaries. And the vascular surgeon, diagnosed disease of your small blood vessels. Now, if the small blood vessels are diseased all over, that's going to reduce the blood supply to your muscles. And the metabolism in your muscles will change from being aerobic, metabolizing with oxygen, to metabolizing without oxygen, anaerobic. And people can probably relate to this. I remember I got it really bad once. I'd been fell walking and I was like squatting down on my haunches. And I got this really bad pain in my calves. And I thought, heck, what's that? And I stood up and the pain just went away, because what was happening is my legs had been metabolizing and I'd reduced the blood supply and I got this severe pain. And sometimes people get it when they're walking. It's called intermittent claudication, an intermittent limp due to the pain. And
also, so I think being inferred that. Sorry to interrupt. This is again just for the listeners. No, I had a PET test, so a cardiopulmonary exercise test. So that was in London, and what they did there, which was really good. So I had that under. I'm going to name drop because this guy was fantastic. A Professor James Hull in London. Everybody, if you need a good seat.
Good one for Professor. Yep.
Yeah. So anyway, they got me on an exercise bike because I couldn't walk with my chest at that point. ECG, blood pressure, mask to analyse my oxygen and CO2. But they put a cannula into my arm and also took bloods every minute out of my ear, just little pricks on my ear.
Yeah.
And what they did was they measured the lactic acid, so that just fits in with what you were saying, John, about they thought it was a mistake. So I started to pedal on the warm-up, and already your
lactate went sky high.
Yeah, so that just is another thing why the vascular surgeon, they've sort of pulled this information together.
That confirms exactly what I was saying, Adam, because as you know, when you're not getting enough blood supply, not getting enough oxygen, aerobic metabolism goes to anaerobic metabolism. And of course, the anaerobic metabolism causes the production of lactic acid. Now, normally that lactic acid would be washed away in the circulation. And it is to some extent, that's why they could check the lactic acid in your ear. But when the lactic acid accumulates in the muscle, that's what causes the crampy pain. Now, everyone watching has probably woken up. I sometimes, when I'm lying down, get cramp in my toes and go, oh, flipping heck. And you have to walk around, and the pain is quite bad. I have seen people in absolute agony with cramps. And of course, with bedridden patients, we have to go around and exercise the patient's legs to get rid of the cramp, because they often can't get up.
Well, when I was in the
very
hospital,
severe.
John, when I was in the hospital in London, the other patients on my ward, they would get in the nurses and doctors, because I'd be lying there like I was at home. I'd be screaming in agony, and they were like, "This man needs help," But that's because, like I told you, I've had cramps in the legs constantly since this started. It's just what you get to live with,
And this small vessel disease explains it. So you've got constant ischemia of your leg muscles, and you know what it's like. The lactic acid. It's like someone's opened up your muscle and poured vinegar into it, because that's what it is. It's an acid. And if you can just sort of conceptualize the pain, if you get a little nick in your finger in the kitchen, people will probably relate to this. And if you get salt in it, that's really quite sore. But if you get vinegar in it, you're jumping up and down with it. It's terrible. And that's what you had. You had this acid in your leg muscles. So that pain you were describing, Adam, is completely consistent with the pathology of that small vessel disease, completely consistent with the high levels of lactic acid, and just the amount of pain that would generate, I simply can't imagine.
Well, if I can't tense some of my muscles properly anymore because of the neuropathies, it's a bit flaccid, but if I try and tense my chest or something, it just goes into this horrible cramp and I can't release it. A
vicious spasm.
Yes. Yeah, but it is what it is. So the vascular surgeon, I'm basically just under monitoring him from now. So he said I'm a big plumber. So he said I do the big surgeries like the stents in your legs. He said that's what I was. He said the good news is you don't need any stents in your legs, but you need to be monitored every year and by me basically. So that's where I am with that.
I mean, that's the irony. I mean, fixing big blood vessels is relatively easy for vascular surgeons. It's routine. Because you've only got one big femoral artery and that divides into a couple of big arteries. And if you need a bit of plumbing, in the popliteal artery behind the knee or something, not too big a deal. Vascular surgeons can do that. But of course, you've got disease in the millions, billions of tiny blood vessels that are actually the last part. So your motorways are clear. It's just the drive into your own house that's blocked up. But of course, it's not just your house. It's all the houses in the country that are blocked up. That just. I hope people can relate to the amount of pain you've been getting there, because if you've had cramp at all that lasts just for a few seconds, and you imagine that Adam suffered that for months, that gives some small insight of the level of pain that you've been suffering, Adam. I think quite incredible. Just give us. There's some other probably more sophisticated treatments that happened. Did any of the treatments noticeably help you?
No, so this is a question I get asked quite a lot. So I'll try and divide it into two. So I was waiting months and months and months, even though I was finally getting acknowledged for NHS appointments, and they're still coming through now thick and fast, because it's like I'm at a point in my life now where if things aren't done, then it's not great. So things are coming through now. But basically all the time, all that I got offered was antidepressants, epilepsy drugs like gabapentin, pregabalin, something else for epilepsy. And then I was basically just getting boatloads of painkillers, cocodamols, NSAIDs. I was getting like half a litre of morphine delivered to my house by the chemist, because I can't get out to pick up my prescriptions. I'm on blood thinners, which I'm probably
was the morphine helping, Adam?
The problem with the morphine is it would take the edge off the pain. So I will only ever take morphine, John, when I can get into like, eights, where, so I'll take it and it'll reduce it to a 7 or maybe even a 6 on a good day. But then it'll last about half an hour. And then yourself, when you're taking morphine and, tablets and the Oromorph and stuff, it's nasty.
I hate it. I just feel sick with it all the time. Hate it.
Yeah, so none of it was making a huge difference. So I take them PRN, which is very rarely now, because it's
just
amazing
as required.
Yeah, just amazing. So none of that stuff has ever helped.
So no benefit from the gabapentin or anything like that?
Oh, I didn't even touch it. No.
Right, so the gabapentin is a drug that we would normally use for neuropathic pain.
Yeah.
So it's a strong drug, gabapentin. It's much stronger than the first line treatment, which is amitriptyline.
Right.
And that wasn't doing anything.
Absolutely zero. No, zero. In fact, it decreased my ability mentally, because of I felt dizzy on it.
Yes.
So
yeah, it really spaces you out.
The only things that have helped me temporarily, but they've been transient. So I've been put on colchicine for the pericarditis, which helps.
Yeah. Yeah.
And I've had a few courses of high-dose steroids, which help. But then, of course, when you come off them, it tends to come straight back.
Yeah, and of course the steroids are only suppressing the inflammation, which means they're only suppressing the symptoms.
Yeah. And then the final thing, which is hard to quantify, but I do believe it's helped me, because my legs were getting worse and worse, and now, even though the muscles are wasting, the pain is, generally speaking, a lot better than 22. So I think the blood thinning medications that I'm on do help for that. So I'm on something that's...
Again, that makes sense. Even though there's disease in your small blood vessels, if the blood is thinner, it will perfuse them more easily. So that... Again, it's consistent.
Yeah, but I brought that up, and this is a whole topic in itself, because it's proven to be quite divisive in the medical community. But I'm on something called triple anticoagulation, which there's some people researching involved with long COVID who are reporting benefits in their research, and I see people, a lot of clinicians and consultants poo-pooing that and stuff. But it has helped me. So yeah, I would say that was the thing. But I've tried to stay away, John, because other than the odd healthcare professional that's tried to help me, and more recently, the way that I've been abused, some of the things that I've been called, like a heroin addict and things like that by people on my admissions, I I was getting no help. So in about November of 2022, it would have been, I started to look at alternative and natural medicine, and somebody online who I met, because I sort of met all these people who are vaccine injured online, a guy in America, he said to me, "Oh, you want to speak to a friend of mine, Dr. Henry Ely, a naturopathic medicine doctor?" And a bit like you, John, I spoke to him and sent him my medical records. He was horrified, and God bless him, really. He sort of took me under his wing, him and his team, and they've been like a family to me. And I speak to him every week, and we have Zoom calls, and we've tried all kinds of natural things. So I would say with the natural things, again, I credit them because when I went into AFib in January last year, and the ambulance found me passed out.
That's the atrial fibrillation in the top chambers of your heart.
Yeah, I think it was. I felt like I was close to dying then again. So I think the natural things have really this year took away the incidences of me feeling like I'm dying. So I had 3 months where I was bedridden again with the heart and the pericarditis in the summer, and there was a few occasions there that I felt like I was dying, and a couple recently. But other than that, this year has been better. So I credit the natural stuff that I've been doing with that. And again, I'll be a little bit controversial, and I wouldn't recommend anybody doing it without thoroughly researching and understanding.
Yeah, I don't think we're allowed to mention names of specific preparations.
Okay.
But these are available.
Yeah.
They are available. If you tell me what they are after, then I'll work out a way to wangle them in somehow. But we're just got to be careful on that one, unfortunately.
Because one thing that I will mention is, and I had a reaction to the gadolinium after I'd had about 4 of them on my heart, or third scan.
What's that?
So when you do an MRI scan, so sometimes of the brain, sometimes of a joint, if you were looking at a shoulder, depends when. If you're looking at the heart, they'll use a contrast medium called...
It's a contrast medium, called
gadolinium. But what most people don't realise is you get told that it's just a dye and it's out of your system in 48 hours, and that's what they tell you on the consent form. It didn't. It made my symptoms horrendously worse. And then I since researched...
Did it?
I since researched and found it never ever leaves the body fully. It's stored in the brain, and they find it in bones of people when they're doing surgeries and things. And it's a recognised disease, gadolinium disposition disease, and it causes something called necrosing systemic fibrosis, which is a nasty disease which causes death. So I have these reactions anyway to it.
Yeah. I remember now you've mentioned that. I do remember that now. So the doctors did tell me actually that they're seeing the vaccine injured react to this gadolinium as well. So it's interesting. Right. So an exaggerated reaction.
Yes. Yeah. What would not?
Or a side effect reaction, which is normally rare.
Yes.
But we're seeing much more common in vaccine injury.
Yeah. So who knows whether it's an allergic reaction, it's a blood flow thing, it's an excretion thing because of my kidneys. Yeah.
Adam, are you living it up on the compensation?
Right, I'm just going to start there. So I've not worked, John, for coming up to 3 years. I want to know, I can't support my daughters anymore. The things that I should be able to do now, because I've been worked so hard in my career. No one's compensating me for my loss of earnings or wages. I don't know how long, none of us know how long our expiry date is, right? But, I don't know how long it got. In terms of compensation now, it's absolutely ridiculous, John. So I spoke to numerous solicitors, so I think 5, and I've been told numerous things. So I was looking at claiming against the government, and I got told that you can't do that because in 2012 there's government legislation which I can find and send to you that the government basically indemnified themselves and brought out some acts that said they can't be held liable for any adverse effects against any experimental use drugs. So of course the vaccine, we weren't told, or I wasn't told when I got my consent, was still under experimental use. So I can't go against the government. So then I've looked into taking a claim against the pharmaceutical, AstraZeneca, because one of my consultants even approached AstraZeneca about my case and said, "This has happened to this gentleman. He's not looking for anything, but do you want to research and find out what's happened?" So they knew the CEO and the head of the vaccine development team at AstraZeneca, and AstraZeneca just wouldn't even entertain it. So then I thought, right, okay, then you don't even want to find out what's gone wrong with your product. For future gene therapies, maybe you might find it useful. So I spoke to solicitors, and the trouble that I've got, John, is I didn't realise this, and perhaps some of your listeners might be able to enlighten us more, but when solicitors work pro bono, they actually have some kind of underwriters that underwrite the company and give them some sort of, I don't know,
legal protection.
Yeah. Well, I'm told by more than one of these that there's something in there where the people that underwrite them won't underwrite them for anything to do with the vaccine, if there's any cases.
So you've actually got a solicitor who's been good enough to work for you for nothing because you're desperate, and they actually can't do the work because they can't be insured for the work.
Yes, so something is coming from, I think, the Solicitors Regulation Authority, squeezing the people that underwrite
or solicitors need to be well insured. I do know that, and they can't work without it.
So maybe I'm just spoke to the unfortunate solicitors, and this isn't the case widespread. So please, if that's not the case, someone tell me. And then
so if solicitors are watching, please let us know that. Are you able to do pro bono work for vaccine injured people and still be professionally indemnified in some way for that? Because I mean, at work, I can't. You can't take a patient to the loo unless you've got indemnity. It's what we call vicarious liability normally from the hospital. But without that, you can do nothing, literally nothing.
So then the other aspect, what people will throw at you, a very weak solicitor, but valid in their point. So they bring up something in law called statute of limitations, which essentially you've got 3 years from when you first knew that you were injured to bring a claim against the person who's responsible. So they're all telling me now that the amount of evidence and expert witness testimony to win a case like mine against a pharmaceutical giant, there just isn't enough time. Now, I know that there's people out there who...
So these guys are they're just walking away.
Yeah, now, I believe, I think if you got a good, some good lawyers, I think any reasonable judge who looked at the cases and seen all the evidence, I think the statute of limitation could be, on these grounds, could be reasonably overturned, I believe, anyway.
Well, just the evidence that you've sent me this morning, Adam, is totally conclusive, in my mind.
Yeah. So, I've got no legal recourse, John, and then I just want to squeeze in again because people say, "Oh, you've got the vaccine injury payment scheme." Well, let me just tell you about our anecdotal experience on that so far as well. They're paying out under 1% of claims. Now, for the vaccine injured payment scheme, right? They've been bombarded because we know this because they've took on all these extra staff, right? Now the problem with it is whenever you have a scheme and there's widespread, it's going to be open to abuse. So I want them to do their jobs properly. I really do. So there's people trying to pull a fast one on it. There's no question about that. Yeah, whenever there's free money, if you like, or whatever, someone will try and fraud.
Yeah.
So I appreciate that. But the scheme is run by GPs, and there's no stipulation of the extent of the experience of the GP. So let's just add that. And they're paying out less than 1% of claims. And I know people in the community who, and it breaks my heart, John, because I've met these people personally. One of them's had a spinal stroke, a friend of mine. He walks permanently with crutches. He ambulates worse than me when I can ambulate. A lot worse than me, struggling going up and down stairs. He's got paralysis in his hand, severe chronic pain like me. He can't work, certainly can't work, and they've turned him down. and I can't speak about his medical
How
reasons.
much worse can you be without? How much worse can you be without being dead?
Now I can't talk about his personal case because that's up for
Yeah.
him. But he's told me the reason, and it is ludicrous. Now, obviously, he's appealed it, but what these people don't realise is that, I know I'll get turned down the first time, and it's the trauma of how long it takes, years for them to assess it and to get turned
And the
down.
forms to fill out and all the evidence you have to
Yeah.
accumulate, and it's just you don't need that hassle.
And I know another guy, John. There's another example: heart attack. He was on intensive care for a month. Blood clots like me in the lungs. Turned down. We can't say it was the vaccine. And then there's
We choose to say it's not the vaccine.
yeah, and then the people that are getting causation, they're saying, well, you're not 60% disabled because you can ambulate and stuff. So that's a difficult one to prove in itself. So I'm having a big whinge about it because it's not fit for purpose, and I'd just like to appeal to the listeners that, I'm not like after 120 grand so I can go and buy myself a Mercedes and go to the Caribbean on holiday, and I've got a load of money in the bank. I was lucky enough.
You'll have easily lost that in wages over 3 years anyway, because you're at the peak of your profession.
John, it wasn't even 2 years' salary. It was almost just over. I could have made that in a year without trying to sound big-headed. So I've lost a year's salary.
Yeah. You're at the peak of your profession. You're highly qualified, highly experienced, and you're working in top flight for professional sport.
For me, like a sensible thing I would feel that, I took the vaccine. It was my mistake, even though I feel the information was withheld.
No, we weren't given the information, Adam.
Well, I would feel my wages should be, in my opinion, compensated until I get to retirement age for my children.
Couldn't agree more.
If I wasn't living with my mum and something happens to my mum, God bless her, I can't live here and I will be homeless. And it's like
you did what the government asked you to do.
Yeah.
And we trusted them.
Yeah. So.
And I tell you what, my sense of betrayal is appalling. So I can't think what yours is like.
So yeah, I just want people to appeal to that. Really, it's not fit in its current status, that scheme. And 120,000. I'm not well enough to go off on holidays and have luxury. I would spend it probably on treatment, or to, like I say, to maybe help my children. Or find somewhere to live. More importantly.
Yeah.
So
Adam, I don't know what to say. It's just an appalling event on an appalling event on an appalling event with a little bit of light from some good people in between.
Yeah. Can I just say, John? I know we need to wrap up.
Anything you like? Anything you like, Adam?
Yeah. So one of my reasons for coming on here, John, and being explicit about my journey and sharing all my medical documents with you is, I know my journey in some respects has been easier than people less injured than me, because they're not getting believed and they're not getting the help. And my reason for coming on is it's just to appeal to, potentially, if this video ever hits any doctors, and some doctors, they're sat in the brew room at work on the break and they say, oh, look at this guy saying he's had all this off the vaccine. If it generates some healthy debate and some healthy discussion and some critical discussion, then for me that's been worth it, because I know we can argue about the data, but I just want to make a point to the listeners and to the doctors and people out there that we need help off, that if the German government data's right, that Andrew Bridgen referred to in Parliament, and the numbers are arbitrary, so it could be a lot higher or lower or whatever, but just say 1 in 800 had a serious adverse event that needed medical treatment.
Yeah. That comes from Joseph Feynman from the original research. I actually interviewed him on that.
Right.
That's a pretty hard number that comes from the original COVID vaccine research.
Well, I'd actually argue, John, that in the UK it could possibly be even higher because of the AstraZeneca, because that was done on Pfizer, wasn't it?
Yeah, correct. That was the Pfizer and the Moderna. Yeah.
Because if you look at the data for AstraZeneca to Pfizer,
it's worse.
It's worse. Anyway, my point is, again, if we look at 90% allegedly of the UK population was double vaccinated.
Yep.
well, that we've got a population of 67 million, and we go 90%, and then we divide that by 1 in 800, then we're coming up with 75,375 people like me. So what I would say is, like, 75,000 people like me, we need help. So, you know, if it was safe and effective or whatever it was, why can't you research us, and, you know, why can't you help people like me and put a service together for people like me? And the reason I say it to also benefit the doctors who are trying to help us, because they're probably ostracised and isolated by their colleagues who think they're whatever barmy or whatever, or they're clinical managers. So the
Richard does explain part of the medical reservations that you've come across.
Yeah, and it's just, why can't we speak openly about this now at 3 years down the line? Because, you know, all I see is it's just trying to be swept under the carpet. And you know, that's my reasons for coming on. And final reason, John, is, like, if you design a product that is a new gene therapy,
yep,
are we assuming the spike protein is the problem here, or is it the ingredients and the gene therapy, or is it both? But if you know, the way that it's going with Moderna and the government contracts and down in Oxford, I'm assuming this technology is going to be used for various other deliveries for other, you know, other vaccines for other things.
That's the plan. The government, the Oxford plant should produce 250 million doses a year of mRNA vaccines.
So then,
terrifies me.
You know, maybe out of 67 million, 75,000 not enough people for you that it's gone. You know, I don't know what number, but that's like nearly Wembley Stadium, right? You know, how many? You know, if everybody in Wembley Stadium died of a disease, would you not be interested in it? Especially if you're going to sell a product that could potentially keep doing that.
Imagine there was a terrorist attack that killed 7 people or 75 people. It would be top thing in the news for weeks.
Yeah.
Imagine it was 750 people or 7,500 people.
Mm-hmm.
You know, like a 9/11 situation, but we're talking about 75,000 here potentially in the country, and that estimate is not ludicrous. In fact, I think it's conservative, Adam, probably.
No, it probably is. So yeah, that's my reasons for coming on, John. And I just want to appeal to people's better nature and you know, for people to work together and you know what they're doing. Yeah.
And the politicians or someone has just kicked the module 4 of the COVID inquiry, if you would want to call it an inquiry. They've delayed that, potentially indefinitely. We should be looking at this as a matter of urgency.
And that's my final point. What I'll say as well is that the reason that I'm pursuing still going to the hospitals, even though I'm getting told now for this muscle disease or whatever they can't help me, I'm just getting it all documented. So, you know, if I do pass away and, you know, shortly, my daughters have all got it, and, you know, it's all on record, because these people can sweep it under the carpet. But history has proven, John, that, you know, with the contaminated blood scandal in the 80s, you know, 4,776 people there. You know, it will come out eventually. It's just that they're trying to do it.
I mean, this makes that look like, I mean, that was appalling, but I mean, this makes that look like a misdemeanor, doesn't it, in relative scale?
Yeah, and, you know, this isn't conspiracy theory, is it? This is...
Are you a conspiracy theory, Adam? Or are you a real living human being?
Well, you know, I took the vaccines, John, and, you know, I paid my taxes and, you know, tried to do what they told us. So, no, I wouldn't say I was, no. But, you know, to me, like, the only thing that I can see that's happening is it's just trying to, right, it will come out, but it's not going to come out on my watch, so then it's okay. You know, these people that should be held accountable will never be held accountable. That is the obvious game here, isn't it, in my opinion? Anyway.
Adam, I know this has been difficult for you. Myself and many people watching are immeasurably grateful for what you've told us. So thank you. And obviously, anytime you want to come back on and update us, it would be a pleasure.
No, indeed, John. As I said at the start, when you introduced me, you don't know what it means to somebody like me.
Well, if it helps, I believe you.
Yeah, it's
if
not
it
just a
helps.
belief. Yeah, no, John, it's not just a belief, but the fact that you're doing the work that you're doing, um, and you know that lots of other people in this, whatever you want to call it, who've come to this conclusion, should we say? I'm just really thankful for them, because people like me would just be swept under that carpet, and it's hard watching life go on, and you know, and not knowing and stuff. So we are so grateful, all of us, for everything that you do, and all the other people. And I know people like yourself and all these other people can't continue to do it indefinitely, but as much as you can do, then just please, yeah. I just We just really need you, and we can't do this on our own because we're sick.
You made a major contribution, Adam. Thank you.